Hi there, 2254. This is Dr. Ang coming to you to present the legal lecture for your sophomore level. Wanted to introduce legal and ethics, but specifically for 2254, we're going to focus on legal. Legal of aspects of the profession, legality, and what that means to you as a embarking on a profession in nursing, as well as it trickles down into as a student nurse as well. We want to start practicing that level of professionalism right from day one as you're entering into not only clinical but even as you're practicing in lab. We want to start to implement good habits and knowing that as you embark on clinical opportunities, you're going to see examples that are done very, very well, and then some that we can learn from where maybe the nurse is a little more lax, or certain environments that it may present itself much differently. And just looking through those, I want to encourage you to look through those professional lenses as we go through the lecture this morning for 2254. So again, we're going to first dive into legal, knowing that legal and ethics go hand in hand. We're going to start with legal. Some of it will overlap, but especially in some of the case studies and as you kind of dive into patient scenarios, we're going to look from not only legal but also the ethical as they bridge together in a lot of scenarios. So we will dive in. I'm going to be going along referencing the PowerPoint that you also have available to you. So as you pull up, I'd encourage you follow along with me. Start by going into the legal module, the legal folder, and going through those resources. We did have a specific legal ethics textbook that we have since done away with. I didn't think that it was necessarily a requirement, just trying to be sensitive to finances and all the responsibilities that you have, not trying to burden you with a lot of extra reading. So I have that more on the suggested reading but not required reading. If you are very interested or have a specific you've seen something, you want to dive into something a little bit deeper, I encourage you, strongly encourage you, come make an appointment with me. Let's peel that back and see what that looks like and kind of tackle that together. I have a significant amount of legal ethic books and resources here in my office, but I'm not putting those in as requirements for you. A lot of what you need, I'm going to give you to be successful on exam 3 in 2254, as well as on the NCLEX. I'm going to give you that information today. So as we go through this PowerPoint, I'm going to point you into the need to know information and steer you away from the nice to know information, but I want you to know that's available should you be interested in that. I am practice as a legal nurse consultant, so I love to take deep dives into these issues, but I realize sophomore level 2254, that's not going to be as, we don't need to get as nitty gritty with that. So we're going to take a little more of a superficial at first glance, and then we'll take deeper dives in the need to know information. So if you kind of follow me, follow my lead with that, you will do well on the exam. So let's get started here. Okay. So learning outcomes, what are going to be the goals for legality for our legal lecture today in 2254? We want to define basic terminology, legality terminology. The terminology that is related specifically, remember we want to keep on the professional lenses, the nursing lenses as we look at legal. Legal is a big beast, but we want to specifically hone in on the aspects that pertain to nursing specifically. So define basic legal terminology, and we're going to hit that as we progress this morning. Identify types and sources of law related to health care. Identify and differentiate concepts of nursing negligence. We will talk about this more as we go through. there's a big overarching umbrella that is medical malpractice. Underneath that, specifically related, legality specifically related to nursing students, nurses, the nursing profession, is under the term nursing negligence. So they're often used interchangeably and hand in hand, but just knowing medical malpractice is going to include a lot of things other than just nursing. Nursing negligence is specific just to nurses. Review standards of care, and how do these standards of care impact nurses? First, we got to know, what is standards of care? Where did it come from? How does it apply to you, and where do you find it? Where do we as nurses find the standards of care? Compare and contrast scenarios related to confidentiality, and what is the nurse's role? So confidentiality is a huge, huge component related to legal aspects. There are a lot of legal cases that surround certain elements of confidentiality. So we want to hit that and take a deep dive into that specifically so that we can avoid pitfalls related to that. And we want to, each of the outcomes that we go through, again, how does this apply to nursing specifically? So if we were in class, we would break out into groups and we would take a dive into just first, in order to realize the importance of legality in our profession and that we are a registered, licensed profession, we need to first see what would it be like if that wasn't in place. And before that was in place, what did that look like? And I like to look at just society in general. Leave healthcare out of it. Society in general. What would society look like if there were no rules in place? And not only having rules, laws, if we didn't have laws in place, what would it look like? If we just all did whatever we felt like doing, very subjective. Some people would feel, hey, if I need something, if I'm hungry, whatever, I will steal it. That's just providing for my family. Just something as simple as that. If we weren't protected, if we didn't have rights that were protected, and not only if the laws weren't in place, what if the laws were in place, but what if they weren't enforced? That's the next layer. But what would that look like? Would you feel safe? Would you feel protected? Would you feel your family and friends were safe as well, or the things that you work hard for, your rights, your responsibilities, you work hard, you have a home, if that home wasn't protected, if you are driving and you're hit by someone that's texting, or they're driving under the influence and they could just drive off and leave you in shambles for things that you've worked so hard for, or if you were in an accident and that wasn't your fault and someone induced pain and suffering on you and there was no form of compensation, what would that society look like? And once we see that, and take a while, you can go through this, or this usually takes a little while in class, but we're going to kind of keep things moving for sake of the recorded lecture. But just looking through those lenses and realizing the importance of being protected in laws, and not only that there are laws, but there is law enforcement. Then now let's apply that specifically to healthcare and to nursing. If we go in, seek a lot of, again, take off the nursing lenses for a minute, and now you're a patient, or your family member or friend is a patient. When you walk through the doors of an institution seeking health care, whatever it looks like, big box house, smaller clinic or urgent care, when you step foot into that, accessing health care, and you know you're going to be, you want to know there are health care standards of care. Please tell me that there is a level that these professionals are expected to maintain. And if they don't, that there would be some protection for me or my family member or my friend. So not only do we want there to be standards in place. We want to know that there are consequences if those are not upheld, so that we know as citizens seeking health care, we are protected. There are laws and there is enforcement of that my rights and my health are going to be protected. That way they can, our patients access care with confidence, and they are assured knowing that we as professional nurses are going to be held to a certain standard. And when they seek health care, there is a duty owed to them to provide. We can't always get the results that they want, but we will uphold the standards of care to do everything in our power to make that and to support them towards those optimal outcomes as nurses. Thus, we are still deemed the most trusted profession. So again, you can look through the questions, you can answer those, or you can skip right on as we go. Why are there laws regulating nurses? Again, kind of already tapped into this, but the practice of nursing requires specialized, we realize this, you're in nursing school, you know how challenging and rigorous this program is. There is a certain knowledge base that we have to build that foundation for you to build and to practice upon. So when we say we want you to use your critical thinking skills, we want you to be able to utilize that knowledge base that you work so hard to achieve in nursing school. Then there are certain skills that you're learning in that skills lab, countless hours of practicing and check-offs in order to get that base of not only the knowledge, and now we're going to also couple that with the skills. And then we get to the point that as a student nurse and you move into that as a new grad and a novice nurse, you're going to be able to make independent decisions, and you're going to know when you need to ask for help. You're going to be able to connect dots from all the knowledge that you have acquired. And as you go through orientation and a preceptorship, it continues to build on that solid foundation where you can practice as a professional nurse and maintain that licensure with confidence. And then, because nursing care poses a risk for harm to the public, people are seeking health care. Our patients are coming. There is a need, and we're going to give our best effort to help meet that need and support with collaborative team effort, healthcare team effort. We're going to work together to try to support optimal outcomes for that patient. So we realize there's a risk for harm, so we need to protect the rights of that patient and protect us as licensed professionals that are trying to assist in that process of optimal outcomes. We also need to protect, as there are, for the majority, for the most part, nurses and healthcare teams, we are all trying to do our very, very best with the resources we have available at the time. There are some, and hopefully a very few, but there are some that are trying to practice and are unprepared or incompetent. So the state is obligated to protect the public from professionals that would fall into that small segment of our profession. Protection is in the form of reasonable laws to regulate nursing, and we have committees that sit and very consciously make effort to make regulating nursing realistic from people that actually have boots on the ground and know scenarios. So it's not going to be so high that nurses can't obtain it and achieve that standard of care, but it also is there meant. So it's a twofold, protecting the patient and also helping protect the nurse and that license that he or she has worked so hard to achieve. What are laws related to nursing? The key here, again, I have a wonky light that will probably go off throughout this lecture, so I apologize about that. This lecture, I want you to realize nursing started at more of a friends and family at the bedside, meeting the needs in that moment of someone that was inflicted by either acute injury, chronic illness, and it would generally be an empathetical, kind soul that would come and sit bedside and nurse that individual back to health. Our profession started in that manner. We have, fast forward now, we have become a profession of registered nurses, and we're going to dive in and see exactly what that looks like. But before we had rules and regulations for that nurse, it was just generally a kind individual that was helping. Now we have very specifics, our standards of care that fall. We have a Nurse Practice Act that was put into place, and you can see this on here. Be aware, and as we go, we're going to dive in a little bit more, but do be aware of all states in the United States. All states have a Nurse Practice Act that covers our profession within that state. Each state's MPA is enacted by the state's legislature. So it's individual to each state. And although they vary, I want you to make note of the things that are specific to all Nurse Practice Acts. Regardless of what state, there will be slight differences in variation between states, but the things that remain the same. They have the authority, power, and composition of a board of nursing. So a Nurse Practice Act is going to identify a board of nursing in that state. For Oklahoma, we have the Oklahoma Board of Nursing. Education program standards. How do we know what to teach and what to require of you as a student here at TU School of Nursing? Well, it's defined for us by the Nurse Practice Act and enforced by the Oklahoma Board of Nursing. Standards and scope of nursing practice within our state. What as a nurse am I allowed to do? What am I not allowed to do? What is within my scope of practice? What is not? That is also found in the Nurse Practice Act. Certain states you will see, and this is where it's tricky, where if you are a travel nurse, you need to be aware of the Nurse Practice Act in each state that you travel to, knowing that there are slight differences. These are the components, but these components aren't all identical. There are certain things that you may be allowed to do in Texas that you cannot do in Oklahoma. There are certain things that they will expect you to do in Missouri that you have not done in Oklahoma. Just as you go, you want to be aware. You're going to you accept a travel assignment in California. Make sure you review the Nurse Practice Act and be aware of what is in the scope of practice for a registered nurse in the state of California or wherever you'll be practicing in. It is not specific to I sat for the NCLEX in Oklahoma, so I just assumed that was the Nurse Practice Act that I followed. That is not the case, especially in the case now where we have compact licensure, where if you're registered in the state of Oklahoma, it also is acknowledged in the state of Texas and maybe Missouri as well, the compact states. Still, if you're practicing a state, you have to fall in the scope of practice of that particular state. And then types and title of licensure. What in the state of Oklahoma, I sit on the ONA board, and this is a big conversation that we're having right now. What's the entry point for a nurse? Right now, you can sit and be a registered nurse if you have your associates. If there's a vast shortage and we need to provide more nurses to the citizens, to care for the citizens of the state of Oklahoma, would we consider backing up the train a little more and allowing someone in a vocational program to be able to sit as a registered nurse? Some have a very strong opinion that it should be a bachelor's prepared nurse. There are a lot of different variances on this, but all of that is looked very carefully and filtered through by the Nurse Practice Act in each specific state. So again, know and be aware of the 4 components that every state, every NPA of every state will include. And then also be aware that there will be additional items and there will be variances within each of these specific to each state. And again, sometimes I have questions about where does the Oklahoma Board of Nursing or the Board of Nursing fall into? They are appointed so the Nurse Practice Act is, again, the overarching, and each one will appoint. So there is an Oklahoma Board of Nursing that will enforce these different aspects within our state, and each state will have a similar composition. All laws are subject to change. Very few things are solid and will not ever have any amendments made. Constitution may be amended, statutes may be amended, repealed, or expanded. Administrative bodies, some will go away, some will be formed and redefined. Judicial laws affect new courts' decisions. So if whoever is the commander-in-chief, the president elects someone new to the Supreme Court, that may trickle down all the way into the laws that will affect us and how we practice here in the state. So know that all laws are subject to change. So why does a nurse need to know about the Nurse Practice Act? Again, touching back on that, it's a right granted by the state to protect those who need care within our state. Guidelines of the NPA and its rules provide safe parameters, not only for that patient, but also for the nurse, that allows us to work in confidence, knowing that if we fall within that scope of practice, that we will be protected. So, bottom line is protecting patients from unprofessional and unsafe nursing practice. The good thing for us as nurses, it's also protecting us, that if something happens, we can be protected as well. I say that knowing there is a very recent case out there that is extremely controversial right now regarding a nurse that feels, and I don't know every component and all the aspects of this, but feels that she did not do something that would have been intentional or malicious and not premeditated, but is facing very, very severe charges right now. So I do realize that, and I want to acknowledge that case that is out there all over social media, all over the news. You're probably hearing about that. But that is a specific case that is an outlier and not the norm. Because generally, if you are proven that you fell in practice within the scope of practice, then your licensure will be protected. And you as an individual, personally and professionally, will be protected. So I ask you to take a pause, and who was the first registered nurse? So the first RN, who was that? Initially, an image that may pop in your mind of her name will be Florence Nightingale. That generally is the response that we get, but the actual first, the key here is registered nurse, is actually Ellen Doherty. She's the first one that practiced as an actual registered nurse. A profession, what sets it apart? Florence Nightingale, mastermind nurse, paramount to our profession. She's blazed the trail for us as nurses. But when she practiced, she was not under the standards of care that regulated our profession as Ellen Doherty. She's blazed the new trail underneath that standard of care. A profession has characteristics. There are requirements for education. There are requirements for the knowledge base that a registered nurse must have. As a registered nurse, it's clearly defined a specific service that we offer. There are things that we offer. There are also things that we do not offer. So we stay within our scope of practice, and that scope of practice is clearly defined. We have autonomy within our profession. Nurses, for the most part, we take care of each other. We guard our profession and we make it stronger. Incorporates a code of ethics. We also not only have a standard of care, we also have a code of ethics specific to our profession. So nursing practice, as you come out, as you're a student nurse, and as you embark on you graduate, you pass the NCLEX, you enter the profession. No, you're not going to know everything. You can be a nurse for 20 years. No, you're still not going to know everything, and that's okay. It's actually a good thing to acknowledge that you do not know everything. You're going to strive to gain as much knowledge and as experience as you can. You want to be competent, you want to be confident, but you will not know everything there is to know about nursing. You won't. But that's the beauty of it, because we're always growing and learning. All of us in the profession are strengthening each other. And something I may feel I'm an expert in, someone else may have another, and we build off of our expertise, bring that together to springboard our profession into new sites and finding new goals and things to attain, whether it's a licensure, whether it's a small thing, maybe it's another degree and it's a bigger thing, but making deposits into yourself as a professional only enhances us as a larger profession of nursing. But when you first start as a new grad, you will be, according to Benner, a novice. Then you come in, you get you a couple years under your belt. Now you're kind of moving in as an advanced beginner. Making note of the fact, if you are in OB, you are learning a specialty area. Whereas if you were pulled out and put into a cardiac ICU, you may not, although you are a strong OB nurse, there are different worlds of nursing. And some you can float in and out of, med-surg units, you can float around. There are some things you will learn, and if you stick in that one spot, you will become an expert eventually in that area, but knowing that you're not an expert in all the other areas, and that's okay. So advanced beginner, you're going to move into competent. You're starting to get that confidence up. You know, now a student nurse comes up, they can be assigned to you. You're eager to share what you have learned, and that's exciting. And then you can go also into being proficient. You're going to be proficient in what you're doing. You're finding even better ways to do things. We don't always do what has always been done. You can say, actually, you're going to start asking why, and you're going to come up with ways that maybe we can do things better. And then you can kind of, as you get later in your career, maybe be deemed an expert where you can teach others about that area that you have worked so hard. So Nurse Practice Acts, we have our licensure, our certifications, and all those expectations and competencies that will help maintain that. Science and art of nursing practice, we have the science, we have the hard skills, but let me tell you, I am passionate about that human caring component, Gene Watson's theory of bringing that art, that caring component. Some call it soft skills, I call it required skills. You have to first show a patient that you care in order for you to care for their needs. That is so critical, that you can meet them where they are. Where do you find the standards of practice? Spoken about these. This is how we know what we can do, what we cannot do. Where do you find them? You're going to go on to the Oklahoma Board of Nursing website. On the far left corner column, down towards the bottom, you're going to see it's going to say Nurse Practice Acts. You're going to be able to see the scope of our practice there by clicking on that. I have also, I don't recommend you doing this, it's a long document. I have the Nurse Practice Act printed in my office. very, very detailed document. If you want to see a hard copy, you are more than welcome. I'm going to have this sitting right here in my office and available should you want to come and view that document. But please go on, see where it is, find out where to access it, peruse through that document, and know that it is critical for you to be familiar with what is in that Nurse Practice Act. If you're ever named in a legality, a legal case, and you are named, you cannot sit if you are questioned and say, I did not know, because that's not going to be a valid excuse. And if you notice, you don't log in to get onto the Oklahoma Board of Nursing website, which means no one else has to either. It's free access. There's not a gatekeeper to that. There's not a login, not a password, just for registered nurses, which means society is just as informed as we are. They know all of this information and they can access it in a similar manner. So they're going to be informed, especially if there is question for a legal case. So please, I can't stress enough how important it is for you to be familiar with the Nurse Practice Act and the state in which you plan to practice. So you can look on here, scope and standards of practice. You don't need to know all the specifics, but the goal to improve the health and well-being of individuals, communities, populations through the significant and visible contributions of a registered nurse, utilizing standard-based practice within the scope of practice. Nursing standard of care, ethical or legal duty of a professional nurse, in our case, to exercise the level of care, diligence, and skill prescribed in the code of practice in his or her profession. For us as nurses, so the Nurse Practice Act, our scope of practice. So I'm going to bring this specific to nursing, but what would another reasonable or prudent nurse have done in a similar situation? That is the golden ticket to how we know whether or not you have stepped out of that standard of practice. There are outliers sometimes, short-staffed. There were not enough resources. Therefore, this is what that day looked like. Obviously, every day is different. Every patient is different. The assignments you get will vary from shift to shift, even from morning to afternoon. Your assignments will vary. Patient requirements, the demands on you will be different. So, in the legal standpoint, it will be viewed by the legal team as, did he or she do what a reasonable or prudent nurse would have done in a similar situation? So, according to ANA, American Nurses Association, there are certain standards of practice that are across the board. So the standards of nursing practice are by ANA. So please note that that's who is the overarching body for the standards of practice. Note, these get a little confusing sometimes. This is the Nurse Practice Act, okay? This is by the state, can be found by the state. The nursing practice standards for a profession are from our national body, American Nurses Association, so the ANA. Make sure that you're clear on that. And the standards here, you will see there are 16 standards. And I like to go through this and think of examples as you go. This is going to be critical for you to know. I am going to review these just a bit. Critical that you know the standards for us as nurses. What are the standards of care for us as nurses that we are expected? There is an expectation that we meet these, as well as there are some there that are protect us as the nurse, as well as are protecting the health and safety of that patient. So standard 1, and I'm going to move very, very quickly through these, but I do want to make you aware. Assessment. As nurses, our assessment skills are key. We start this from the first interaction you have in nursing school in the skills lab and going in when you start to embark on your clinicals, assessment skills. The registered nurse will collect comprehensive data pertinent to the healthcare consumer health or situation. We assess, and we not only assess, we assess thoroughly. Diagnosis. The registered nurse analyzes assessment data to determine the diagnosis or issue. We do not diagnose, but we are knowing that the care we're going to implement is going to be in line with that correct diagnosis. So things that we will do or we won't do must align with the diagnosis for that patient. Outcome identification. As an RN, we will identify expected outcomes for an individual in the healthcare environment. So we're going to make sure that we are outcome driven. We want to support optimal outcomes for our patients. And then planning. The RN will develop a plan of care plans that you're going to go throughout nursing school. Know that there is a plan of care. We have a reason and we have a roadmap of how we can ensure that we are supporting optimal outcomes for our patients. Implementation, we want to implement the interventions identified in that plan. Doesn't do any good to have the roadmap if we don't implement that. And then evaluate. Is what we're doing working? Is there something we could do better? Is there something we need to eliminate in order to support that patient? Then critical. The registered nurse must practice ethically. There are so many components. We will get into this in 6.4. So many ethical components that are critical for us to work, because we also have a code of ethics that we also need to work under. Again, protecting the patient and protecting us as the provider. Education. The RN attains knowledge, and not only do we attain it, we're going to stay current in what we learn. Evidence-based practice. As we all seek knowledge and we are obtaining those degrees and those certifications, we are going to get really good at what we're doing, and we're going to base our actions and our as we implement and put things into that plan of care, we're going to do so off of evidence-based research. So we are going to have that scholarly component as well, where we're going to say, again, is it working? If it's not working, find new ways. And we're going to publish that so that we can help strengthen other nurses in providing evidence-based practice, which in turn is going to be better for the patient. If we realize we are sending patients home with Foley catheters in, they are returning with UTIs, and some even going to the point of turning septic. If we realize that, we can continue to do what we've always done, or we can stop and say, those statistics are alarming. What is it? Let's research this. Let's find out why this is happening. Let's implement something else. What else could work? Are we sending them home too soon? Is it something that we're doing with the catheter? What can we do to support where we can change the way we're doing this, because this is not working? This is producing adverse effects rather than supporting optimal outcomes for that patient. So researching that and then taking steps forward to implement a plan of care that's based on evidence-based practice that will support that patient. Quality of practice. The RN contributes to a quality nursing practice, again, as we've mentioned, making it stronger every day that you're there, every shift that you're there, every opportunity, whether it's the education department providing continuing education. Give quality practice. Communication. The RN communicates effectively in a variety of formats. When you're a member of the healthcare team, you need to have, we've talked about therapeutic communication, not only with the patient, with the patient's family. You need to be able to communicate well with your healthcare team. If you're delegating, delegate very clearly and then follow up. If there's something alarming or that's not within normal limits and you need to give those results, you need to effectively communicate with the provider, with physical therapy, with the pharmacist. Be an effective communicator within that team. Collaboration, again, feeding off of that communication, you can collaborate care with the above named mentioned as I just discussed. Professional practice evaluation, the RN evaluates his or her own practice. You step back and you reflect. A true professional is going to reflect. You're not going to beat yourself up, but you're going to learn from your mistakes, and a mistake shouldn't happen repetitively. So things need to change, but you're going to take that time for self-reflection and find out if you're doing your best. Am I functioning in the best role? Maybe I realized I thought I wanted to be a peds nurse, and I really don't feel like I'm effective with kids. I think I would be better maybe in the OR, or I would find where you work best, that implements and feeds off of and enhances your strengths, and then can also help you build on your weaknesses. But be self-reflective enough to be self-aware and know that. Resource utilization, the RN utilizes appropriate resources to plan and provide safe and effective by being financial responsible. Find better ways to do things, more efficient ways to do things. Help your as you're an advocate for your patients, help them find resources, some even free resources, community resources that can help them even specifically with a new diagnosis, or they come in with an unexpected injury that's going to send them home in a different scenario than in which they came in. So now maybe they need a wheelchair ramp, or they live in a 2-story house and now they're coming home and they're going to be with a walker. Help them find resources and put them in connection with that, because environmental health, RN practices environmentally safe and healthy manner, doing all we can to help support nursing and practice and in the environment as well. Find ways and things that we can do in the community, or things that are a threat. Be an advocate out in the environment, in the community. That also helps strengthen you as a professional, as well as the profession of nursing as a whole. Code of Ethics, again, I mentioned this is going to be tapped into a deep dive in 2264. Just tapping on it very briefly for those of you that may only be in 5.4. Code of Ethics is a philosophical ideas, right and wrong, and defined principles used to provide care. It's important for you to incorporate your own values and ethics into your practice. You need to realize and self-reflect on put your personal lenses on, do some self-reflection. What drives you? What are the key attributes and values that are interwoven into you and make you who you are? Identify those, because as you look through then your personal lenses and then your professional lenses, sometimes they'll align and sometimes they won't. So make sure, if at all possible, you are practicing in an area that aligns with both. That's going to be the least disruptive to you as an individual, if you can do that. Sometimes that's not the case. You may be asked to do something that does not set well with you, with your values as a person. So be self-aware. Ask yourself, how do your ethics, values, and practice compare with established standards? So if certain aspects of our profession are not in line with you, you need to be aware of that. And as you look for a job and you look for where you want to ultimately plant, in what soil and what culture, be aware of certain ethical considerations that may be specific to that unit or that area. Women's health would have specific attributes that would have ethical considerations, may be different than in a hospice unit, may have much different, but also ethical dilemmas that you might find yourself in. Certain ones may be more or less disruptive to you as a person. So it's just something to be aware of, because ultimately, if you choose to practice in that setting, even if it isn't ethical rub to you personally, you still must follow suit to the profession of which we have entered. So just be aware of that. We'll go into that more in 6.4. Nursing practice variety of settings, but we want to protect, promote, and optimize patient health. If you're in the community, if you're in one of the big box house institutions, ultimately you're in the clinic, you're in home health, you're in hospice, our goal is protect and promote, optimize patient care, patient health. Prevent illness and injury, bed rails up, if there's a spill on the floor, things that they could trip on, IV cords. We're protecting from further injury and from further illness. All the techniques that we do not to cross-contaminate. This is why we're helping to protect from additional illness and injury. Alleviate suffering through the diagnosis and treatment of human responses. Advocate for the care of our patients. And then the duty owed. If I am your nurse for that day, I'm going to give my absolute best care that I can during that time underneath the standards of care within my scope of practice, because I have a duty owed to that patient as a registered nurse in the state of Oklahoma. I'm going to do everything I can to support the autonomy of that patient and advocate for that patient's needs. Here again, the art of nursing, it's important. I have to get to know that patient and care for that patient and let that patient know I care for them, to be able to understand and comprehend what the desires are. Let that patient have self-determination and autonomy, and until I get to know what that is, I can't adequately advocate for that patient. So that's why that aspect is so critical. Professional roles and responsibilities. We're responsible for obtaining and maintaining specific knowledge and skills. Before, again, I mentioned it was basically to provide care and comfort. Now we're emphasizing health promotion, illness prevention. We have taken this to a whole new level, but yet we don't want to forget about the aspects that we started on. Our grassroots effort of simple care and comfort. Pain management is so critical. Caring for that patient. And as we on the spectrum transition to, we're going to emphasize health promotion. Okay, how can they keep coming in with this certain condition or this certain challenge? How can I help promote where we can stop the cycle and the trends of certain things, identifying that, researching that, evidence-based practice? It all falls into that scholarship and that profession of adding and making life better for our patients and for us as nurses. So, critical that you know this slide right here, basic terms in healthcare. This is saying healthcare ethics. It does cross through and bleed over into legality as well. Critical that you know these, not only that you know them and identify them, but you're able to apply them and able to recognize them in a case scenario, a case study, a patient scenario that you can identify them. Autonomy, commitment to include patients in decisions for their care. I don't know as a nurse what is best for that patient. I'm not going to coerce them. I'm not going to persuade them. I'm not going to be judgmental on their decisions. It is that patient's right to determine what's best for them and their patient in their care. So I need to advocate for them and their autonomy. Let them choose. Give them all the information and resources available, and ultimately let that patient choose what's best for them, and then help to carry out those wishes. Beneficence, taking positive actions to help others. Beneficence is doing good for a patient. I am going to make sure that that patient gets a proper bed bath. I'm going to make sure that that patient receives if I'm a pediatric nurse, so if I want to ask them, I realize that child has lost so much control. I may ask, do you want green or red Jello? Do you want to, we need to ambulate today, twice today. Do you want to play a game? Do you want to do this? We can do it either before or after. We just have to do both, and we have to make sure that we do I'm going to let them have choices. I'm going to let them, again, supporting that autonomy, right to determine. I'm going to offer things to that patient. I'm going to go the extra mile to do good for that patient. Now, maleficence, obviously, the opposite of avoiding harm. I will ensure that even if, as a registered nurse, I delegate to assisted personnel to turn a patient, I'm going to follow up and make sure that that is done, because I'm going to avoid harm to that patient, and knowing that the risk of them getting a pressure ulcer, bed sore, would be very likely. So I'm going to follow up to avoid harm. If I know a patient is going down for physical therapy, I'm going to do good by offering them pain meds about 30 minutes prior, because I want to avoid harm in them getting this scenario where they're going to be in pain and it won't be as productive. So you can avoid harm. That one could be looked at from two angles. Justice, you want to be fair. Fair to all your patients. Be fair to a patient that may be in a room and people, when you get shift report, they're telling you the patient's non-compliant. They've been accused of a crime. They may give you all kinds of negativity about that patient. And you think, well, hey, then I feel sorry for, maybe I'm more empathetical for a patient that I tend to resonate more with. Fact of the matter is, in the legal lenses of nursing, there should be justice to both of those patients. You're going to provide optimal care for both scenarios. Justice for all. Fidelity, agreement to keep promises. If you tell a patient, I will be right back, or I'll be back in 15 minutes with pain medicine, if you get tied up in another room and can't be back, you need to call into that patient and let them know, or send someone else. But keep your promises. Don't make promises that you can't keep, is the flip side of that. Statutory law, acts passed by elected officials, state or federal. Criminal law, the difference between common and civil law are similar. Criminal law is there is an intent and premeditated, and just as it says, criminal. Common or civil law, there can be more cases of this was not premeditated, this is more of an accident nature, and we're going to get all the details that surround that before a determination is made. If you are named in a criminal law, that is going to be a lot harder to defend, and it's normally, again, surrounded by the fact that it was probably a premeditated. Criminal defense is going to pull not only within consequences within the Board of Nursing, but also this is going to come out into, you're going to be facing criminal charges, both personally and professional ramifications. Again, the criminal and civil, just know the difference. Nursing negligence can be either based off of what you're doing. Here's an example that it seems to be a little more clear. If a patient falls, I had a duty owed to protect this patient. They fall on my shift. We're going to need to get the details surrounding that to see if there was an error or breach in my care. However, if I'm going to give narcotics to a patient, and instead of administering those narcotics, I'm slipping them in my pocket and taking them home with me, that is a criminal offense. And obviously, you can tell the difference of how those are weighed out, and how the consequence would be much different. But again, with the civil case, it's argued, it's similar to if someone rear-ends you when you're driving, different things. They probably didn't intend to rear-end you, but you got to get the details. Were they driving under the influence? Was the person What are all the details around? Were they on their phone? They'll get all of the information before a determination is made. Whereas a criminal offense, you took that home, you signed off, you gave it to the patient. You clearly did not. That was a willful, premeditated thing, bringing that out, regardless of why I said I was doing it. Much different case. So, stealing money from a patient's wallet while they are down in surgery is an example of which type of law? So, the stealing would indicate that is premeditated intent. So, that would be C. Negligence, again, there's a duty to perform care, provide optimal care for a patient. Examples of nurses violating criminal laws. If you want to look at it, these are some historical cases that are very informative. Don't spend a lot of time on this unless you're just very interested in this. Tort law. Torts are anything that will land you in court. That's all you'll need to know on this slide. This is the slide I want you to make sure that you're aware of. Elements of a tort. First, I have a duty owed to a patient. If a patient comes in through the emergency room, they come up to my unit, I'm assigned to that patient. I now have a duty as a registered nurse to provide a standard of care outlined by the ANA and then enforced by the Nurse Practice Act, the Oklahoma Board of Nursing. I have a duty owed, and that is protected to that patient. They know with confidence coming in that if they are assigned, when they are assigned a registered nurse, that I have a standard of care that I will adhere to. If there is a breach, a failure to show proper care, I either do something I should not do, or I forget to do something I should do, whichever, I have a breach in that care. Then there's an injury that patient occurs. There then has to be the fourth component. You have to have all four. The breach caused the injury. If I have a patient that comes in, I'm assigned to a patient on my floor. I am helping the patient. I have the bed rail, one of the bed rails down. A code happens next door. I'm pulled out rapidly to help with that code. Unfortunately, I leave the bed rail down. I have come back later, realized it was down. The patient was rolled over, did not fall out of the bed. I helped get them safe and secure, pull up the bed rail, realize that was technically a breach in care of safety, but the patient didn't fall out, didn't hurt themselves, harm themselves in any way. Okay, now the patient is being discharged later that day. They go out, and when they are being brought from the wheelchair into their car, they slip and fall, and they break a hip. They come back up to the unit. They have surgery, they come back up to the unit. Now they're complaining that this happened while they were at the hospital, and they try to say that I did not practice in a safe manner because I left the bed rail down. Okay, should I have left the bed rail down? Absolutely not. That is not safe practice. Okay, I was the patient's nurse. I left the bed rail down. They tried to say that I fell and broke my hip. The hip had nothing to do with the bed rail being down. Although both we wish wouldn't have happened, they are not have direct causation. So the breach did not cause that particular injury. Therefore, this tort case would be thrown out. Okay? If I am assigned as the nurse to a patient, I give an incorrect dose of a medication to a patient that then goes in to shock and nearly dies, leaving them in the hospital now for an extra 3 weeks due to all the ramifications of that breaching care. The causation of me making that med error did cause that injury, so there is direct causation. Now, constitutes all four elements of that tort, and I could be named in a nursing negligence case. So which of the following is not a requirement for a tort? Remember the four that we just went over? Right, duty, breach, injury, and causation. So the one that's not is intention. Types of courts, this is interesting if you're into that composition. Do not need to know this for cases for the exam. Statute of limitations. If you're going to be named in a lawsuit, the patient, the one to which duty was owed, has 2 years, a 2-year window in order to file that claim. After that 2-year window, they can no longer come back and name you in a claim related to that specific incident. The rationale behind this is that potential defendants should have the opportunity to defend themselves with a reasonable time period. This is why it's so critical. 2 years is a long time. A year is a long time. I can barely remember what I did last week. Therefore, it's so important that we document. You document clearly, concisely, but where you can come, and if your medical records were all of a sudden blown up on a big screen in a court for all to see, they're free of judgment, they're free of bias. You don't need to get petty. You don't need to get overly extensive. You want to be thorough, but you want to be very, very precise. Cover, even if you offer something and the patient declines, you need to state that very clearly. If you go in to help a patient, different things that you do, I went back in to reevaluate. I went back in to check, assess, all of those things. It's good to put a narrative showing that you are interacting with that patient on a regular basis. Again, keeping it very, very precise and professional. Legal limits of nursing. Sources of legal guidelines come again from the statutory law that is the overarching four nurse practice acts. Remember, criminal and civil fall under there. Administrative law, common law, focus on statutory law for sake of this exam. Nurse practice acts fall under statutory laws. Critical that you know that. Administrative agencies, don't take too much time worrying about this. This is, if it's an institution, it's a hospital, it's clinic, urgent care, everywhere is going to have governing bodies for that institution. So specifically, again, if you're working within one of the large hospitals, they will let you know what their policies and procedures are, and you will want to fall underneath that if you want to be protected by their legal teams. You want to stay underneath their umbrella of policies and procedures specifically for that institution, and that will come from administration. Usually multiple disciplines are on that, and they help to determine what's appropriate and professional for that specific institution. Legal limits, again, standards of care, guidelines for defining nursing practice and identifying the minimal accepted of nursing care. Best known comes from American Nurses Association, the ANA, as we've mentioned, set by every state, set by state and federal laws of govern where nurses worked. Joint Commission requires policies and procedures. When they come around, they make sure that we're doing what we're supposed to be doing. Proof of negligence, the slide that we just went over. Duty, there was a breach, there was an injury, and then there was causation. Professional negligence, again, nursing negligence is going to fall underneath medical malpractice, is basically all that you will need to know. If it applies specifically to nursing, which is the point of this lecture, nursing negligence is what we want to focus on. Here are some specifics: failure to assess or monitor, including making nursing diagnosis. Failure to assess and monitor. If you delegate vital signs to be taken, vital signs are taken, something's not within normal limits, you cannot blame that on the assisted personnel that took those vital signs. Although they should have appropriate therapeutic communication within the team, advocating for the patient to let you as the nurse know, it's up to you to monitor that. If vital signs are not within normal limits, you need to monitor, you need to assess, and then you need to notify the provider if that's what needs to be done in a timely manner. Failure to use proper equipment or monitoring the patient, and then if you don't document appropriately, documentation is key. Again, you'll hear this over and over and over, but if you didn't document it, you didn't do it. You cannot say that you did. In court, you can't say, oh, I went in there, I monitored, I assessed, I actually did this, this, and this. If you didn't document it, it's not going to hold in a legal scenario. Failure to notify the healthcare provider of concerns, and then if you don't, basically you don't follow orders. What the orders are, the plan of care is an agreement among the team, and your part as a nurse is to implement your roles. If you fail to do that, then you are standing outside of the scope of practice, and nursing negligence can be named. Failure to follow the correct rights in medication administration, knowing your rights, knowing the patient's rights, identifying that patient, the drug. We need to avoid medical errors at all costs, so following the correct rights of medical administration. Failure to convey discharge instructions. If you just think, well, I'm busy, so I'm just going to send them home, and you don't review certain things on how to take medications, and don't take this medication in the morning because of this, and this, or you need to give all the information of this don't drive when under this medication. Make sure you have a follow-up appointment at this time. Not going through that, not letting them know what to expect when they get home. How do they care for their wound now that they're going home? Who do they call to line up to come? Give them that plan of care for discharge. That's failure to do so can be defined as nursing negligence. Failure to ensure patient safety. Patients who have a history of falling, if they're going to be heavy sedated, etc. Talk through that and make sure there are checkpoints in place. Again, delegation, we can't blame, we can't make excuses, we own it. As professional nurses, we own it. If something was delegated, vital signs weren't communicated back to us, and they weren't within normal limits, we had delegated for that patient to be turned or ambulated, and it wasn't done, that's on us. As the professional nurse, that is on us. Realizing that delegation is absolutely critical. You can delegate and have someone do it, but if they don't do it, it's just as though you didn't do it. State statutory issues in nursing practice, licensure, Good Samaritan laws, public health laws. The whole concept of if someone goes down and requires CPR, that whole thing. If you've done BLS, you know, trying, you will be protected in that moment. Do all you can. Don't be an innocent bystander that just stands and stares. Okay, jump into action. Use your professional knowledge that you have to try to advocate and help for the best outcome for that patient in that moment. And in that moment, you would be protected. 4 elements of medical malpractice. Again, what I want you to know here is just the bottom part. Duty, breach, there was an injury, and there was causation. We can leave basically the medical malpractice out of it. You know that's just an overarching goal to nursing negligence. As nurses, nursing students, we want to focus on nursing negligence. We do have some case studies. I'm not going to go over those in the PowerPoint because I just want you to hone in on these, the critical components that we went over. Give you time to look at that Nurse Practice Act, to give you time to focus on the scope of practice. Follow with ANA. Go on the website, see where that is, find the resources there. Go on the Oklahoma Board of Nursing or the Board of Nursing in your state in which you plan to practice. See where the Nurse Practice Acts are listed. That's the information I'm going to want you to know. Go back to that slide that is the 4 components of nursing negligence. How do we know if it would be an actual case of nursing negligence? And then know that the golden ticket that we continue to say is Did you do what another reasonable or prudent nurse would have done in the same scenario? Okay, and they'll be calling in nurse experts to give that information. This is what a reasonable and prudent nurse would have done in a similar situation. If it's a civil, wasn't premeditated, think it could have been avoided, but it wasn't intentional, if you get into a case that falls into some gray parameters, that will be the question. Did he or she do what a reasonable or prudent nurse would have done in the same scenario, with the same resources, with the same patient load, on the same type of unit? That will all be explored. Then go to the slide about definition. Know the knowledge level, and not only that, but be able to apply that in a patient scenario or a case study. Autonomy, self-determination. The patient has the right to choose what's best for himself or herself. Beneficence, non-maleficence. Go through all of those. Justice for all, fidelity, keeping your promises. Know those definitions, be able to apply those, and you will be good to go. Don't worry about, I'm going to go through just in case. Nursing students, you're liable if your actions cause harm to a patient, just as your instructor, hospital, and university would be. You're expected to perform professionally when rendering care. We keep a really tight, rigorous program because we want to make sure we are fostering professional nurses, professional nursing students. You must separate your student nurse role. So if you work as an aide or you work as an assistant personnel within a hospital, you cannot access things in the medical records that you may access as an employee. If you don't have a reason to be in someone's chart, you should not be in that chart. If you are talking about any aspect, this is the confidentiality part. It's tempting as a nursing student, as a nurse even. You know what I had in room 304, you wouldn't believe this. This is what I saw. This is what happened in this room. Can you believe this is what happened that brought this patient in? There's not a place for that. Legally, you do not go and post anything on any social media. Even if it's not photos, you don't do anything that could be deemed where someone can track it back to an institution, or even worse, to a specific patient. Keeping your personal and your professional academic career and professional career separate is critical to keeping you out of legality concerns. Slander is when you speak and ruin someone's reputation, or you're bridging confidentiality, bridging HIPAA violations. Slander is when you're speaking. Libel is the written word, so typing something, putting something on Facebook, Instagram, whatever your platform might be. Those are all aspects that can get you named in a legal suit. So confidentiality is critical. If you're not specifically talking in a private environment with someone that needs to know the information in order to provide care for that patient, then you're bridging confidentiality. If you're accessing an electronic chart, paper chart, whatever, of a patient that you are not directly caring for, you are bridging confidentiality, and that is a legal concern. If you have any questions on this whatsoever, it's just all falls underneath the huge umbrella of being a professional as a registered nurse and practicing as a professional. So important. If you would want to discuss any of this, I encourage you to reach out to me. There are other slides in here. Please just stay focused on the aspect that's in the blueprint, as well as what I have highlighted thus far for legal. And I will be back with you for ethics for 2264. Last thing I do want to get to is the slide on incident reports and occurrence report. It's always better to report yourself. For a new nurse especially, if you make an error, there's going to be that tendency to want to hide it or fix it and think it doesn't need to be reported. I don't want to think that my manager to know or to feel that I'm negligent in my care. When it's the flip side, it is so important that you are honest and upfront with any errors that are made so that that can be fixed later. And it can be, it's a very, very strong learning process, because many times an error can happen and you realize, oh, they need additional training in that area, and it can actually help you. Because you write up an incident report or an occurrence report, or you're listed in one, that does not mean that that is a negative thing. It can be a learning opportunity, but advocate for your patients and for your professional license as a registered nurse, and be upfront and honest enough to own your mistakes so that you can become stronger. Don't get into that mode and that tendency of hiding things. That can fast forward and lead into someone that's documenting things that are inaccurate. I'll just switch up these vital signs a little bit and enter that one. Really, I never took the vital signs. Honesty and integrity is paramount for the profession of nursing, for not only you protecting your license, but for that patient and all the patients that you will care for. I have an example of one of those on there as well. But it's an amazing profession, and I welcome you to this point as a student nurse, and I look forward to helping you build your professional skills and honing in on those as you enter as a student nurse, and then enter the profession as you graduate and pass the NCLEX on the first try. I want to support you in this, and I want you to not be fearful of making a mistake, but know what you need so that you have a solid foundation of knowledge and skills where you're not only competent, but you're confident in delivering those skills and bringing that knowledge to the bedside in the clinical setting, using those critical thinking skills for our profession. So if you have any questions for me whatsoever, please reach out. But you do not need to do any required readings again, as long as you went through this PowerPoint. Follow the learning outcomes, and in the meantime, if you have any questions, please reach out to me. Take care, guys.